Hello, and welcome to the Public Health Shift audio edition. I'm Nadia Tekkal. In this space, I read and reflect on each issue of my newsletter, creating a pause for public health professionals to think more deeply about how we work, what we prioritize, and what the current moment is asking of us. This episode is based on issue 16, What the Next Phase of the Public Health Shift Demands. When I first started writing the public health shift, I was trying to name something many of us were already feeling, that public health was changing, but not always in visible or linear ways. A few years on, that sense of transition feels less abstract. The question is no longer whether public health is shifting, but what this next phase actually demands of us as practitioners, consultants, leaders, and system thinkers. Not more activity, not more urgency, but different ways of showing up. The next phase of the public health shift is not about recovery. It is about returning to what existed before. It is about operating in a context of permanent uncertainty where funding landscapes are more fragile, institutions are more scrutinized, and trust is harder to earn and easier to lose. At the same time, expectations placed on public health professionals continue to expand. We are asked to be technical experts, strategic advisors, facilitators, communicators, and system thinkers, often all at once. So, what this phase demands of us is discernment. It is the ability to decide where our expertise genuinely adds value and where it does not. It is the courage to say no to work that looks important on paper but is misaligned in practice. And it is the willingness to slow down enough to think systematically, even when urgency pushes us towards quick fixes. This next phase also demands a shift in how we define impact. Because not every contribution needs to be visible. Not every success needs to be scaled. Actually, some of the most meaningful public health work currently happens in strengthening relationships, in improving coordination, in clarifying roles and responsibilities, and in supporting decision-making behind the scenes. These forms of impact are definitely harder to measure, but they are often what allows systems to function under pressure. There is also a growing demand for boundary setting in public health work. Sustainability is no longer just a buzzword for programs and policies. It now also applies to people. Burnout, fragmentation, and chronic overload are not individual failures. They are system signals. The next phase of the public health shift asks us to take those signals seriously and to design ways of working that are realistic, humane, and long-term. Finally, this phase demands honesty. Honesty about what public health can and cannot do alone. Honesty about the limits of technical solutions in deeply political contexts. And honesty about our own capacity as individuals and as institutions. This is a call for moving beyond performative urgency and towards thoughtful, grounded action. As you listen, you might want to reflect on a few questions. What does the current phase of public health demand from me specifically, not from the sector in abstract terms? Where might I be operating on momentum rather than intention? And what would it look like to design my work, whether consulting, research, or implementation, for sustainability rather than constant responsiveness? You don't need immediate answers. These are questions to sit with. Thank you for listening. If this episode resonated with you, I invite you to continue the reflection in your own time, during a walk, a commute, or a quiet moment away from screens. You can access the written version of this issue by subscribing to the Public Health Shift newsletter on www.nadiatekkal.com. Until next time, take care and keep questioning how we show up in our work.